Hello, my name is Lori Marion. I am the nurse in the office as well as the IVF coordinator. I like to refer to myself as your tour guide or cruise director through the IVF process. I will be meeting with each of you individually to go over in depth how to use your medications, why you're using your medications, but please refer to these videos for any refreshers you may need along the way. And as always, please feel free to contact myself or Dr. Yasinkaya with any questions throughout the entire process. We're now going to discuss progesterone injections. The easy part of this injection is it requires no mixing. It comes fully mixed in the way it needs to be given. It is a multi-dose vial, so this vial will last you for about 10 injections. To use this medication, just pop the top off. Use one of the pink package needle and syringes that you received with your medications, and draw out 1 milliliter or cc, the terms are interchangeable, of progesterone. The progesterone is an oil. It's about the consistency of Crisco, so it's going to be a little bit thicker and a little bit harder to work with. So sometimes you have to draw back a little extra and push up to where you need to be, but you want 1 milliliter total. Make sure the black part of this syringe lines up with the 1 on your vial. Once you draw out the progesterone, unlike some of the other medications that I've discussed, you want to always keep this at room temperature, never refrigerate it because it will become very viscous. At this point, some tips to make this injection a little easier to use. If you can roll it around in your hands or even under some warm water before giving the injection, it's going to loosen up the oil to make it a little bit easier to inject. So that is a tip that you may want to use when doing this injection. Once you have it in the syringe, ready to use, and you have warmed it in whatever way you prefer to do, you want to take off the needle that you used to draw out, so you'll screw off your pink needle. And you will have received in your package a bunch of gray 22 gauge needles. Screw this needle on. And this shot's going to go in your buttocks. If you'll notice my diagram here in figure 1, if you think of each butt cheek in 4 quadrants, the upper outer are your safe zones. On the day of your egg retrieval or at your appointment immediately following your appointment for a transfer, one of the nurses in the office will be glad to take a marker and draw circles on your buttocks to give you the safe zones to aim into. But if you look at this diagram, you'll see that the upper outer quadrant of each butt cheek is the appropriate area to inject into. With this injection, this needle is a little longer than other injections that you have been using to this point. The purpose is this shot needs to go what we call intramuscularly, which means it needs to actually go deeper into the muscle. This liquid is thicker and it needs to be able to kind of dissolve a little bit easier into the muscle tissue. So we do want this needle to go, it doesn't have to go all the way to the hub, but you need to at least go 1/2 to 3/4 of the length of the needle into the skin for the injection. When doing this injection, go in and right before you're ready to push the medication in, pull the plunger back on the syringe just a tiny bit. We're doing this to check to make sure that you did not land in a blood vessel. More than likely, you're going to draw back your syringe. You're going to see absolutely nothing happen, just like I am with my air injection now. You'll see nothing come into this syringe. If you see nothing, at that point you're fine to go ahead and do the injection. If you see blood come in the syringe, then you want to immediately take the needle out, change. You can still use this medication. It's your blood and it's sterile. Change and put on a fresh needle and go to a different area within the safe zone to do this injection. After the injection is complete, some ways to make this be a little easier for you is if you can get you a heating pad to sit on at night. Sometimes that'll help with the soreness in the muscles. And also just make sure that you are using those muscles and kind of stretching things out after the fact, even though it is sore. It's going to be helpful for these injections.